is everybody tonight? I'd like to welcome everybody to the Ashland Board of Health meeting for April 18th, 2023. Just a quick statement. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. So we'll call the meeting to order at 6:05. And as always, the first, item is citizens participation. Mark Dasoni is always a participant. What do you got for us tonight, Mark?
Good evening, all. Happy spring, and it's somewhat coolish out there.
Yeah.
Well, how's everybody doing?
Doing good.
Good. Thank you.
I would like to salute the town, the health department, and everybody on board for great coverage of what was not needed yesterday for the marathon. All hands on deck, first responders, police, fire. There could have been a couple of health personnel, just in case anything did happen, and gratefully it didn't. I want to just congratulate myself. This is going to sound conceited, but it's not. I am what you call a long-time health nut, online, in-person Zoom meeter, and I'd like to congratulate myself for not getting the big head. So this is going towards what's on the agenda. Are you going to be talking about for next? I think it's the next award for the Mary Mortensen's award.
Mm-hmm.
Mary Mortensen and myself, nobody actually knew other than Diane, that we hit it off so well that Mary could have been my mother and I could have been her son. So I'm saying it for the board all around who does not know history, that Mary Mortensen should get a plaque somewhere in this town, somewhere around, to keep her name in eternity to work on, because it's well deserved. And if anybody on the board and health, anybody in the town hall could get things going, I want to applaud an idea that she gets a plaque somewhere in town.
Okay.
Thank you. That's it.
Yeah. Okay. Thanks, Mark. We will we'll take that up with the appropriate people, but that is why this is named after her, and at least that plaque is in the town hall, so that there at least is some remembrance. I don't know how much jurisdiction we have over that, but we can certainly try to find out. Okay. All right. Victoria, I see you're up. Victoria Wheeler, who's our awesome intern. You have a poster presentation for us. You're going to tell us how awesome it is to work with Raj and Laura, right?
Recording in progress.
Yes.
Yeah.
I will share my screen with you guys. There is also, I believe there is a version sent to you by email as well, but I'll share my screen to make it easier for everyone. Let's try to do it as a presentation. Oops. Sorry. Okay, so hi, I got a nice little intro, but for those of you who don't know me, my name is Victoria, and I have been an intern with Raji and Laura at the health department. I am a senior at Worcester State, graduating soon in May with a public health major and as a psych minor. So I have had the honor to work with Ashland and with Raj and Laura. So I just have this little poster that I'd like to share with you guys today. Just keep in mind that the poster's main target audience is for Worcester State students. So some of this information, since you guys do work for the town, you might be familiar with.
Yep.
Okay, so I just did a little section on the background first about the Ashland Health Department. So the Ashland Health Department's mission statement is to protect and promote the health, environment, and well-being of the town of Ashland's residents and visitors. Some of the site services that they offer range from inspections, investigations. We also have our vaccine clinic and training opportunities. The target populations, the main population being the Ashland residents and Ashland community. But other populations also include the uninsured and underinsured children, which we have at our vaccine clinic, children from the Metrowest area. And then also the other populations would include the senior residents that are 65 years and older that we do our blood pressure clinic with. And then I just have a little thing where I talked about finding the site, where I used some of my school resources and also reached out to you guys that way. I have figure 1 here where it just shows where Ashland is for people who are unfamiliar, but obviously you guys are all familiar of where Ashland's location is. For the site role, I have a great opportunity to do many different things, mainly including but not limited to the blood pressure clinic at the senior center, where I help assist Nurse Jessica, the childhood vaccine clinic for the underinsured and uninsured children ages 2 to 19. There's food inspections, septic inspections. I've attended the meetings with you guys. I have helped write grants, create logic models, and sometimes I'll do a little bit of social media or newsletter work when needed. I just highlighted 2 of the main projects that I do for my internship. So the first one that I liked to highlight is the blood pressure clinic. So like I said, that is where I help assist Nurse Jessica, the town's public health nurse, with taking the Ashland senior residents' blood pressures. Usually we do this about once a week on Wednesdays, where the seniors have a workout class, and we'll go after the class and offer if any of them would like their blood pressures taken. So I have a little picture of myself in figure 2 with one of the senior residents, and I'm taking her blood pressure. We usually use one of those blood pressure cuffs that you can get at CVS, but the Nurse Jessica also does have a stethoscope if anyone would like to do it the manual way. We use these little cards that are provided by the state where we can track their blood pressure. We can write it down for them. A lot of them bring it to their primary care physician or a doctor. And then there's also time for them to ask Jessica questions if they want to know how to reduce high blood pressure. So we're able to do some health education with them as well, which is really nice. Some of we have really positive outcomes, a lot of great feedback from the residents. They do like actually participating in the clinic. They tell us every week how they thoroughly enjoy seeing us and the service that the town has to offer. And also what we noticed is the residents are seeking cardiologists, which is great. So even a few of them have told us that they have taken some of Jessica's suggestions and they have reached out to a cardiologist. So that's what it's all about in public health. Even if it's one person, that makes all the difference. So it's been really great to get to know the seniors and work with that and do some health promotion is really nice. And then the next one I highlighted was the childhood vaccine clinic. So that is here at the town hall, where I will work with Jessica and Raj to help them with the clinic. We do this on Wednesdays as well. And the clinic was when the town and the Metrowest area noticed that there was a need for childhood vaccines. Many children in the Metrowest area are either uninsured or underinsured with health insurance, and they have not received those childhood vaccines that most of us who are born here in the US get right when we're born and throughout childhood. So the clinic provides 10 plus vaccines, which include but aren't limited to polio, varicella, Tdap, DTaP, Hep A, and Hep B. So every week we will offer those to the children who need them. And our methods include the school nurses reaching directly out to Jessica, and they'll be able to make their appointment that way. We also have community health workers that work with us, and they also act as a language line for some of the children who English might not be their first language, or obviously for the families who English might not be their first language. And at the clinic, I am able to get the vaccines from our vaccine fridge on site and help prepare them for Jessica. And then I'm able to help log them with Raj. And yeah, we just go from there, assisting in whatever Jess might need and helping answer any of the family's questions. I did include a picture, which is of Nurse Jessica vaccinating a child. And he looks really happy, but sometimes, you know, they're not always that happy. But you know how it is. They're children.
Yep.
And then I also included a visual statistic that we got from where MIIS, which is where we log and keep track of all of our data of the vaccines. And I know it does have some that start at 0, but this did go back to 2 years, and our clinic has been only up and running for a little over a year now. But as you can see, from October to January, the clinic has done, excuse me, has administered about 1,000 vaccines. So over from March 1st, 2022 to March 1st, 2023, over 700 vaccines were administered to the children in the Metrowest area. And then that graph just shows the data from March all the way to February. But like I mentioned, that showed a 2-year frame. So that's why you can see the high spike just in the October through January. But that is really awesome. And it was great that there was a need in the community, and the town saw that and had this public health program. We also can promote health literacy and education to the families as well. So it was really exciting to be a part of that. This last section was mostly just for the students in my school. It was just lessons learned. So I just had some advice to students to prepare for their practicum by reaching out and just making sure that they speak to their professors and stuff like that. But yeah, this is all I have for you guys today. And I appreciate you guys having me on these meetings. I have learned so much, and I really appreciate you guys taking this time to let me share my post. So thank you.
Yeah, that's great. Great
any
job.
questions, you guys are welcome to ask,
Yeah.
or any comments you would like to make as well.
Yeah.
I have
Laura,
a
can you
question for you, Victoria.
Yeah. Thank
Excellent
you.
presentation. What on the graph? What there's the blue plot. It's now that I'm not looking at, but I think it was previous year historical. What is that?
Yeah, so that was from the MIIS data. And I believe what it was is Jessica, the nurse, provided me with those with that graph, and it showed the history of it. So every time we logged the vaccine, it just gave a history. But since that was from 2 years ago, there isn't a previous history of her logging the vaccine since the clinic didn't exist. So I believe that's what the history one meant. And then the other one just showed the actual administering rate.
Got it. And what's next for you after you graduate?
Yeah, I'm interested in grad school and pursuing a public health degree with a concentration in global health. I have also been setting up interviews with other towns, like the town of Holliston. They have a grant there, the Drug Free Coalition, and I have my second interview with them this week. So I'm hoping that will work out. But
Good luck. Good luck.
thank you.
That's great.
Yeah.
Yeah, that was a really terrific, well put together presentation. The graphics are great. I know I couldn't do that, so you did a really nice job. So I'm sure that with this level of preparation that you're going to succeed in whatever you decide to do. So the best of luck. And I know that if there's any way Raj can help you, he's a really good mentor. Certainly has been a mentor to me, for the year and a half or a few years that I've been with him, and shown me a lot of stuff. He definitely knows his stuff. So I'm sure if you ever need him, you can, certainly reach out. Unless, of course, I'm wrong, Raj, but I don't think I am.
A lot of learning from you, sir. Thank you.
Yeah.
Yes, Thank you.
So, yeah, well, yeah, congratulations. So when actually is the big day?
May 13th, so coming very soon.
Yeah, that's awesome. You have any time after, or are you just diving right into the next thing?
I was willing to just dive right into the next thing. I've
Yeah,
been telling the interviews like May 14th, I'm ready.
you're ready? Yeah,
Yeah.
well, that's great. Yeah, well, best of luck with everything.
Thank
You
you.
know, okay.
Thank
All
you.
right. Yeah, thank you for that. Okay.
Good job.
Raj, I'm gonna turn over number 4, body art regulation with the town council review to you, if you don't mind.
Yes, sir. So I just want to update the board, after we did, I guess this was 2 meetings before, we kind of took a vote on adopting the regulation, but
Yeah.
I found out, the council need to review too, and now they have some comments, so
Yeah.
I don't know if
Right.
any board member have any questions, or we can give it till the next meeting, for anybody if you have any questions, and we'll do another review ourselves and maybe, discuss it next meeting and then go about it, But
Okay.
they don't have any major comments. There were some edits and some questions,
Yeah.
that we'll be able to answer.
Okay.
So if
So-
any board members, meanwhile, have any comments, please send my way, and we'll present it to you, back to you guys, the board, next week,
Okay.
next meeting, I mean.
Okay.
Thank you.
Right. All right. Thanks, Raj. I may as well just keep you on for any comments about the fee schedule changes. That.
Right. So
Yeah.
We want board to approve 2 changes. There is one fee we are bringing. That's on my agenda. It's actually for that we are doing a new application. If a food establishment is doing any changes, any change in operation, or any renovations, we have put it under minor and major renovations. That we didn't had it before. And we definitely want to grab that.
Okay.
That we are introducing a $50 fee for that review. But if the food establishment is doing any equipment change or menu change, there won't be any fee, but they still have to let us know that if they're doing any major changes to the menu or they're changing any equipment, So that's the one fee change. And there is another fee that we do right now is housing inspection for group homes. We have 3 group homes, that we charge a very nominal fee for $95 right now. So we are increasing that to $125 per inspection, so that's another change that we want the board to approve.
Okay. So we should vote on that, I'm assuming. Is that correct?
Yes, sir.
Okay.
Yes.
Anybody want to make a motion to approve
Can I ask a
those
question first?
changes?
Please.
Sure.
Yeah. So Raj, how do we come up with the fees? Are these like comparable fees to other communities? And the increases, are these like cost of living type, increases? Like what?
So yes, Dr. J, I guess this was adopted, this fee schedule was adopted. I guess it's on the document, I guess maybe around 20 years back or something.
Mm.
I guess the fees is from that time. With this group homes, right? The fee that we went, building department do the similar inspection, right? They charge $125. We was at 95. It's the same that we usually go together with the building department as well as the fire department, So, but 95 at this time is very nominal, very low fee,
Yeah.
I mean, it takes our time to review the application, do the inspection, sometimes follow up, on if there are any missing items and all that, So I guess it's fair, right? Like the building department also charges $125, and we do. And then these inspections are not mandatory inspections for Board of Health, we kind of do it just for the help to them, It's not like one of our mandated duties, So it's definitely consume our time, So that's why we're trying to increase it, And about the other one, like the review fee, yes, that's definitely the communities charge it, we did had a discussion. I have a discussion with my supervisor also, that we are just doing fee for the renovations, In that case, we have to review the plans, the equipment and all that stuff, and we do have to do inspection, once the changes are made or the renovations are done, So that's why the review fee of $50.
Yeah. Yeah, I was just curious. Thanks for explaining that. And I didn't go, look around to see. Question really wasn't related to the specific like group home stuff, but just in general, when communities set these fees, are they comparable to other communities in the area like Hopkinton? And is that how it's done? We look around and gauge what other communities are charging for?
Correct, sir. This particular one, I don't know if a lot of communities do it, because, not again a mandated function of Board of Health, But
Right.
if you ask me what private people, if they have to call in a private inspector and get these inspections done, and a lot of towns, they do it. Like, there are housing specialists, private housing inspectors who do this, they definitely charge more than double what we're going to be charging.
Yeah,
So,
good point. Right.
it's still very nominal, but it take
Recording
our time.
stopped.
Mhm.
Recording in progress.
Thanks.
I'm just curious too. Raj, what exactly do you inspect in the group homes as a Board of Health?
So, Bernadette, it's like we do have a form, right? We do almost everything, we do check for fire alarms, water temperatures, we check the food facilities, making sure everything is working, we do go to the rooms, that they get kept in sanitary way, water temperatures, exteriors. It's like almost every item, that we go from sanitary point, if there any pest activity or all that stuff, And if you want to look at the form that we do, I can send it out, even to
No, really, I
yourself
was
or
just
the board.
curious. I was just
Absolutely.
curious. Yeah.
Just for you to see, like, what all we record.
Yeah.
So yes.
Okay. Thank you.
Oh, absolutely, yes.
Right. Okay. Yeah, thanks, Raj. That seems pretty nominal, especially for the food establishment plan reviews. If you're going to also include an inspection in there, or is that an additional fee?
That is so. We had a discussion, again with Jen, right?
Yeah.
If it do consume a lot of our time, but at this point, like, all we want to grab is like if people are doing changes,
Yeah.
that they're doing it correct, especially with the equipment,
I hear you. I'm just on your side. It just seems,
right, sir.
That seems like almost nothing. Is there a fee that's charged for the inspection with that, or does that include the inspection, the $50 or the $100?
That will include, sir. So that $50 will include it.
Yeah, that's pretty inexpensive for all the time it's going to take you. That we're definitely losing money just charging that much, but I get it. So okay, all right, that's great. Anybody else with any other? Barbara, you have anything? No.
No, sorry, I'm good.
Oh, okay. All right, great. So does anybody want to make a motion to approve the increases, or actually the new fees for establishment plan review changes in operations for a new facility or a major renovation, and the service inspection for housings to the new stated fees? Anybody want to make that motion, or at least agree with that?
My working memory is not that good, Ron. So
Yeah.
I can make the motion to approve
what I just said. Okay.
Yeah, not
good with
sure
that.
the rest of it, but
Yeah, I'll second that.
All right, that's great. I didn't even ask for that, but that's exactly what you do. All right, all in favor? Aye.
Aye.
All right. That passes 4-0. And again, I'm sorry. I probably should have asked if we could have changed the order of the meeting. So we'll head back to 5. The Mary Mortensen Public Health Award. More than likely, we should probably have Ed here for this, but I don't know if anybody has anybody that they'd like to nominate. But I'd certainly like Ed to be a part of this, and just for that, he usually knows at least a few more people. Raj, you have anybody that you were thinking about for this year?
Sir, not me, but I guess I
Yeah.
have sent it to Jen and Mr. Hubbard. I guess
Yeah.
they might have a candidate. I'm gonna ask them, to communicate that to the board. I guess there was some conversation, so I'll ask them.
Yeah. Okay. All right. Well, I would say one of our members, I think, Jay, I think you've done, an exceptional job, along Ed as usual. He deserves it to me every year, but for you to take the initiative to put together this remote access medical is really a terrific undertaking and a service to the not only Ashland but the surrounding communities. And I know by what you're doing, it takes a hell of a lot of time, and you're really doing a great job of making it happen. So I know we don't typically nominate us, but I think you would be an awesome nominee for this. I certainly would do that. It really takes a lot of effort to do what you've done, for you to spend all that time to go to different remote access medical areas to get their input, to see how it works, to make this happen with Ed and all the other people that you have to do. So I'm thanking you for the board as well as for the surrounding towns for all the effort that you've put in. It doesn't go unnoticed, that's for sure. Yeah.
Thanks.
Yeah. Yeah. You're welcome. So, but I would just say, we ought to just have Ed here for it. So maybe table this until the next meeting. Is everybody okay with that?
Yeah.
Okay. That way it'll give people a little bit more of a chance. I actually had, forgotten that we were going to do this, but it is a nice award for exactly the reasons that, Mark had said. We wanted to try to, keep Mary's, contributions to the town of Ashland as far as the Board of Health is concerned for all those years, and all that she did, alive, and have people remember that she did this. And, it's a nice thing that we started. So, we'll be able to pick somebody. There's many deserving people, that's for sure. So Laura, we'll fit that on next meeting. Okay.
Sounds good. Yes.
All right. All right. Good. And Jay, we'll go with you for remote area. Anything new?
Yeah, we're still chugging along, planning and getting soliciting donations and volunteers, and soon it will be sending word out to patients. But I guess the most important update is that what we're planning is a childhood vaccine clinic and a COVID-19 vaccine clinic, which would be held in the Loring Arena. So the RAM clinic is going to be at Keefe Tech. So we are planning with a couple of the other community free medical programs to run these vaccine clinics over at Loring Arena. And in addition to that, we would have Mass Health sign up opportunities for patients over there as well. So there's a reason for that. The community resources that we have coming into the clinic, these are local groups and organizations that will provide information to patients. They're not allowed to collect any information. They can't take any personal information, which is what you would need if you were going to sign people up for health insurance. And so we thought that we would locate that over in Loring Arena and make that completely separate from our clinic, though we would be able to refer people over there. I mean, you can walk over from Keefe Tech. And since we were doing that over at Loring, we figured we'd also run the vaccine clinic there as well. So Ed Berman, if he was here, he could speak more to this, but he'll be running that in collaboration with about 3 other local organizations. One is the Latino Health Insurance Program in Framingham. The other one is Gratis Healthcare. And there may also be the Edward M. Kennedy Community Health Center involved in that, though I need to talk to them about it. So that I think that will be huge, and will be a really big draw for the vaccine clinic, but as well as the RAM clinic, because when people are over there getting their vaccines, they'll tell them, hey, if you need anything, dental, medical, whatever, vision, go next door. You can see there's a huge clinic over there. And likewise, at our clinic, we can tell folks to go over to Loring and get their vaccines. So, so that's, I guess, the biggest update.
Okay. Are the vaccinations, are they going to come out of what we have in stock, Raj, or Jay, do you know that, or where we kind of getting those from?
I think that my understanding is that the Latino Health Insurance Program has the stocks of, or will have the stocks of vaccine, but I'm not sure what Ed Berman has in mind, or if anybody even talked to you about that, Raj.
Not yet, Dr. J, but Dr. Ron, I mean, we can definitely provide the vaccines, The only problem is the transportation of the vaccines,
Right.
That there was some issues, that we have faced earlier from DPH, But other than that, like COVID should be relatively very easy transporting, I guess there is no restriction on that. Childhood vaccines is a little tricky, but definitely, if that's the need, we'd be happy to do it,
Yeah.
We should be,
I would think though, if there's a big need for that, or if you can, at least you could give people information, because you have these childhood vaccine clinics, they would be welcome back to come over to when you do them. So they don't necessarily have to be done exactly that day. It'd be nice if they could, but that's always an alternative way to do it.
Right. And it takes multiple sittings for kids to get vaccinated,
Right.
But we'll definitely be able to take those kids, like right now we are working to increase our capacities for this clinic, That's why we have vast funding, we've applied a couple of grants on that, to increase our capacities for this clinic. But I'll work with the team, for providing the vaccines, but it shouldn't be a problem right now, so we should be able to do that.
Yeah, so maybe we'll, it's a good point, Ron. So maybe we'll loop you in soon on that, Raj. And the reason I didn't include you in that meeting was it was sort of just a kind of an introductory meeting with these three programs in Ed Berman, just to see if it would even be possible if we do this.
Right. And absolutely okay, sir. It should not be a problem, but like, we should be, and we can ask if Jessica is available as one of the vaccinators. I know Mr. Berman have a lot of people, that we can pull, but we'll bring people from our team also, for that.
That'd be great.
Yes.
All right.
Barbara, I'm sorry.
I was just saying I'm here if you need more hands-on for.
Thank you.
Thank you.
Yeah, feel free to sign up, Barbara, for the clinic as a nurse. And so that, just to be clear, that vaccine clinic is not going to be part of RAM. So there's no sign up or whatever. So if you wanted to be over there helping out, you just get in touch with Ed directly, and you guys would figure out, the logistics. But if you wanted to sign up to volunteer at the clinic, that's a more formal thing. And you'd go on the RAM volunteer website, find the Framingham event, and then sign up through that. So
I've been a bunch of people from my job too. So
okay. And so for volunteers that are working at the RAM clinic, they're looking for people that can spend the whole day. If that's not possible and you just wanted to kind of do half day or something like that, then the vaccine clinic might be better in that case. So it's totally up to you.
Sounds good.
Sure. Thank you. Yeah, and that's all I've got, Ron.
Okay. All right. That's great. Thanks very much, Jay. Appreciate it. All right. Raj, we're back to you.
Yes, sir. Thank you.
Yeah. So help your agenda for today.
Thank you.
Yeah.
So we do have a childhood vaccine COVID clinic tomorrow. Now, the COVID clinic is just for the again, one booster dose, that is approved right now. Today, what FDA did, they approved a second bivalent booster for 65 plus people, by that, I guess it should be a week or so. It's going to get approved by CDC and then come to DPH for approval. But another bivalent is approved today, But the clinic we are doing tomorrow is just for the first dose, for the bivalent people who are eligible, With the Nyanza, this was on April 3rd that we had a press conference, EPA, DEP was there. We got additional funding for Nyanza cleanup. It's going to be the final round. And I don't have the numbers right now. I mean, the DEP, EPA said they're going to be working on it, but it's the monies that a federal grant have been approved, for the, I guess, 20 sites that Ashland is one of them, and we are lucky to get that grant, So it should be some more work happening around Nyanza site. With the
Raj, I'm sorry.
Please.
Can I just ask you a question about that? So when you say additional funding for that, what is that just going to include monitoring, of that, or is there actual cleanup? I mean, you're not talking about a major expense of actually removing that napple from the ground, which I know can be done, but you're not speaking about that, are you? What is it?
Yes, yeah. This was a question that came in the conference, actually, they're going to be putting together what they're going to be doing, definitely more monitoring, and there should be some cleanup too, but
okay.
I guess it's still early, with the information we have. But they were saying it's going to be some time before the funding comes over and they're planning, what kind of interventions they're going to be needing, Definitely more vents, that they have done some vents, for the mitigation, I guess some things on those lines, but I don't have that full information at this point.
Yeah, no, that's fine. I was just very interested when you said, more for cleanup, other than remove it. I don't know really what else you can really do. I mean, I know that's an expense, but that's a way to mitigate, to me, everything. But I know that's a big expense. But
right, they did mention that there are a lot of better technologies right now that they have at their disposal, to use, that what was available before, so definitely more stuff coming. But we were just glad at this time, that we got this grant, the town got it, and it'll be helpful, for further mitigation.
Okay, that's great. All right, thank you. Sorry.
Can I ask a question on this subject?
Sure.
Okay, to Raj, doing that press conference, was there any mention on an ongoing progressive report that they've been doing for the years?
I mean, they're definitely doing it. So, but it's the EPA, DEP who have this site, I can check and see if there are any data available, and I can update you, but it's their jurisdiction, but I can check with the coordinators.
Because I know from the years past, they did have some sort of like a 4 or 5 year period of progressive reporting on the ground inspection and air ground studies and stuff like that. I was just wondering if that was actually mentioned on the site itself.
Yes, I will check, we'll get back to you if there is any recent reports, that they have published.
Thank you.
Yeah, you're welcome. So regarding the food establishment application, as I mentioned with the fee schedule, at this point that all we are trying to grab, that if any food establishment is doing any of these changes, we just want them to know that they inform us, so we can guide them if they're buying new equipment, if that is approved equipment and all that, So, I mean, reach out to us, any food establishment, if they have any questions, we'll be happy to help, But definitely, I mean, they inform us before making any of those changes, especially they're buying new equipment, doing major renovations, or stuff like that.
Right. Raj, just for me, is there a way that this information gets communicated to all the establishments so that nobody kind of, gets in trouble with kind of what happened before with the Thai place, and so that we can preempt that? Or
yes, sir. So we're going to be sending it out. We Laura have made a group email, that we can send information.
Great.
Hey, Raj.
Okay,
I'm
awesome.
sorry.
Oh, sorry.
Yeah.
I don't know if you were still talking or not. It sounded like you stopped. Question for you.
Sorry, that's gone.
Yeah.
That's all right. So can you give us an example of like what a change in menu? What type of what's the threshold for a change in menu? I'm adding fries to my menu. Is that
our interest is more, these questions have come multiple times, like, hey, so what comes menu change, so what we are trying to grab, if sometimes the establishment go from one menu to a totally different menu, right? Like if somebody is serving one kind of food to another one, usually what we look at is, if when we do our plans, right? But when
you're cutting in and out, at least for me.
Yeah.
Right. So the proteins, right? Like, if they're adding proteins, we need definitely more storage, stuff handling and all that. That's one point when we do plan reviews for the establishments, right? So if they are doing 3 proteins, 4 proteins, there are a space requirement accordingly. So because we cannot mix different proteins, right? So that's what we look if they're adding to it. And then there are certain foods, right? Like supposedly somebody is just adding mussels, right? Or some sort of shellfish they're doing, right? There are different requirements, around those shellfish, that we need to make sure that they come from a certified vendor. They need to keep the tags for at least 90 days, that's a requirement, stuff like that. So sometimes, the food establishment just not aware, for the requirement around it. So we just want to make sure that if they're adding something new, it's just for their safety, right? Like they are doing it right. And I will like to give you another example. Supposedly somebody just want to add ice creams, that's vended from a machine, right? Like, cones and all that. There is a monthly requirement about getting the samples, like there is a bacteriological samples they need to do for the ice creams, So stuff like that, we're just trying to make sure, right? Like, they are not adding something that there are requirements around it. And
so if I owned a restaurant, I never have, so I don't know how this works, but would I know when to contact the Board of Health if I was making one of these changes to the menu? Would that be clear to me as a restaurant owner?
It's complicated, but we will be sending information, at this point, we're just trying to catch, like, if they're not doing something totally different of what they are allowed, right? Usually starts initially with when they open the restaurant that we do their plan review, right? Like in that plan review, we definitely look at the menu. That's the most important component, and everything revolves around the menu. Like, how many items, the more they're going to be putting on the menu, that there are space requirements, like dry storage, refrigeration, freezers, that they are all attached, And because previously we was not doing it, now this is a requirement in the code, like if they are making any changes, they need to be notified to us, The other example I want to take about the equipment, right? Now, people, and I've seen this, right? I came across at least 5-6 establishments that they changed the equipment, Now, what the food code needs, that any equipment that's coming to a restaurant is certified equipment, They need to be certified with one of the marks, that we get it from NSF, UL, ETL. There are like 6 approved by ANSI, So if they're not bringing certified equipment, right, then it can be a problem. It can be a fire problem, and stuff like that. So we just want to make sure when a restaurant or a food establishment is buying new equipment that it's certified, that is approved by the code, So if they reach out to us before buying it, we can guide them like, hey, is this a good choice, if this is a valid equipment.
Right.
And in the market, there is so much stuff, like, but if you buy certified equipment, it's like better for the establishment. It's, more safety from safety angle, and all that stuff. So that's what we look. And this is all in the code, it's all written in the code that, hey, all these are the requirements,
Yep. Thanks.
Oh, absolutely. And we have pick up another housing case at the Chestnut Place Apartments, 13 Joint Drive. We're working with the management. This was a little bad housing case, can send the board a copy of the inspection report and the order letter we send. But again, we are working with the management, that finally the Family Dollar fine was paid last week, I'm glad, we did talk to the attorney that was on the meeting, I made a couple of calls to the manager, but I'm just glad, that the fine is paid now. But the nursing grant, as Victoria mentioned, she have helped us write this grant, she was part of it, and we have submitted the final grant application, This grant is initially one time for $20,000, that we have applied for a vaccine clinic, and hopefully hopefully we get this, and there can be an extension also, for this grant. The marathon yesterday, thank you, Dr. J. We did have one person again, that we assisted here at the middle school, that he was not able to run any further, that we bring him to one of the centers, and they bring him to the train station so he can go back. So he had kind of cramps and all that. He was tired when he got around the middle school. There's some beaver activity, and we have issued a permit on Indian Brook. They're going to be doing some trapping for the beavers. Tomorrow the permit is starting. This is a 10-day permit that we grant. I did go out for inspection. The beavers have took down one whole tree, and I mean, I guess there was damage to maybe 5-6 trees in the back of the house. So they had concerns over the safety, that a tree can fall to their property, or
Sure.
Stuff like that. So we have to issue that. And I'm open for any more questions.
Yeah, but been a couple of years for the beavers, but that's definitely every couple of years it seems like you get one or two of those. Any updates and with what you're permitted to say about 135 as far as that goes? That house on Pond Street, isn't it Pond Street?
Dr. Ron, yes, we had our hoarding task force meeting today. Also, we discussed, so one of the younger brothers, was here last week. Wednesday we had a conversation. Yeah. And as we've been requesting them from past 4 months now, right? I have asked him. They said they are interested to do the repairs, and we are totally okay.
Right.
But I've asked again them to put a written, information to us that what they plan to do and how they're going to be doing it. It's like that we have no written communication from them so far. Given the number of items on that, we just need a solid plan, to allow them back and do repairs, So
sure.
Both sides were trying to work, we did discuss this today at the meeting, So hopefully something more to it. We're going to have a meeting, myself, building commissioner, and Jennifer Wolfing from Human Services, tomorrow probably.
Yep.
But this is where we are, but we have nothing from them in writing still.
Yep. So they're still not. Where are they living now then? Since they can't live there.
They are housed in a motel in Framingham. That's the.
Oh, they're still there.
Right.
Okay.
And is Ashland paying for that?
No, sir.
No.
They are paying. We did pay for the first 2 weeks, and after that, I guess you was in that conversation, Dr. J. They said they are okay doing it. I guess it's called Monticello or something. There's a motel in Framingham I guess that was the last information we have that they are living with it.
Mhm.
I know it's tough, but the living conditions there was like very, very tough, So,
Is there an end to this if they keep telling you that they're going to present a plan to you and then they don't do it? Within, whatever it is, 6 months or a year or something like that? Or is this just indefinite?
Dr. Ron, one option we have is to file this in court, and probably ask for a receivership, kind of a deal from the court.
Mm-hmm.
That's one possibility. Hopefully they come up with something,
Right.
The other issue we have, there is a gentleman, who is living in one of the campers, I would tried multiple times for him to move his camper. He's kind of, because this property is condemned by Board of Health right now, right? I mean, he should not be present at the property, but he's still living at the property. So, but it's like a little more challenging, for us.
So Raj, can it stay just condemned indefinitely if the owners were okay continuing to live in the motel, which I imagine isn't really a solution, but if they decided that that's what they wanted to do, what happens?
So, sir, the Board of Health have authority to demolish the building after 1 year of passing the condemnation order, So
Okay.
the board can actually order a demo of the building, if nothing been done, and this happens, even given the conditions, I mean, I don't think we go that far, but, it's not my expertise at this point, that I don't think so the property is repairable, to what conditions we went in, it's more like, building commissioners, that he knows more about the structural stuff at the building, But if they're going to be moving with the repair, it's going to be a very tough repair. That much I can comment. Given the building was very, very unsafe structurally. When we went in, like when 3-4 of us was going up to the second floor, we were scared that it might fall, so or we fall through. So that was the things we have seen in the building, with like no heat, no water, very limited electric, there was stuff, that I don't know how repairable they are at this point, so.
Okay. All right. Great. And anybody else?
I just question, Raj. On just like on the COVID numbers, how are we doing in Ashland? I know there's just a new variant that just came out.
So numbers are kind of low, but that won't be the correct number because I guess 95% of people are home testing right now. So those data doesn't come to us. But like the PCR tests that get reported to the state, right? I usually see 1 or 2 cases, every other day, like maybe 3-4 cases a week right now, that comes through, so but those are not true numbers, so but so I mean, I don't have the correct information, about the numbers, but maybe 3-4 cases a week, that.
Okay. Well, thank you.
Okay. All right. All right. Raj, thanks very much for the update. Moving on to the consent agenda. Anybody like to make a motion to approve the review and approve the Board of Health draft meeting minutes for March 7th, as well as the year-to-date budget report for fiscal year 2023?
I'd like to move a motion to approve the consent agenda, review and approve Board of Health draft meeting minutes for March 7th, 2023, and review the budget report for the year 2023.
Okay, that's great. Thank you. Any seconds?
Second.
Second. Okay, all in favor? Aye.
Aye.
Okay,
Aye.
looks like that. Okay, thank you, everybody. It looks like that passes 4-0. And anything else on the future agenda, which would items, which is our agenda item 10. So apparently we're May 2nd, and are we still virtual for that, Raj? Are we in person? Is there a law for that now?
So yes, so again, board's decision, but we can stay
Okay.
virtual, I guess, till March 2025 now. So,
Okay.
but again, whatever the board.
Oh no, I'm good with that. Unless anybody wants to meet, although I'd like to see everybody. It'd be kind of fun to do that, but yeah.
Only other thing is May
review that.
16th is the town election, so we have to come up with the alternative date, but we can discuss that on May 2nd, so.
Okay.
If there's gonna be another meeting this next month.
Yes. Right. Okay, so we'll review that. We'll review the groundwater, whatever the variance is, Mary Mortensen, and I'm sure we'll have all of our usual things on there as well. So, okay, anything else? Anybody, any questions or concerns? Barbara, Bernadette? No?
No.
Sir,
Okay.
I
Great.
have one more request. So we have the green up coming, our
right.
green up next month, if anybody wanna join,
Green up.
When is that, Raj? It's usually, is it the first or second weekend?
Yes, sir. So green up is on May 16, Saturday from 9 to 12.
Are you going to be there?
Yes, sir. I will be, yes.
Okay. I'll help you out with that. I used to do that with Mark all the time. So me and you will talk. I'll help you out. Not a problem.
Thank you. It's fun. It's fun,
No, I agree. Yeah, it's nice to see, everybody getting together and getting out there and doing this stuff. So yeah, that's great. I'll talk to you.
Thank you.
Okay. Yeah. Thanks.
Yes.
Okay.
Okay.
All right. Put it on my calendar. Okay.
Hi.
Right.
So what is the green up about? Hi, my name is Nkiru, but you can call me Kiki. This will be my first time of joining the Board of Health meeting because I kind of wanted to see what we talk about. I am interested in the Board of Health, and I don't know, I'll be running for position on the board this year, come May.
Yeah.
I just wanted to take this time to introduce myself and kind of the members here. I'm sorry, I can't turn on my camera right now because I'm in the middle of something. But what is the green up about? Is there something that is open to the public to help with?
Sure. Well, yeah, thanks for your interest in running. That's great. Raj, go ahead.
So we have a Green Up Ashland is a committee, that do work around, cleaning Ashland. There is a website, we can send you the link. They do this event every year in May, around the Earth Day that we do clean up. And then, there are volunteers that join. We do different cleanup for the different streets. And then there is a program that where you can adopt a street as well, throughout the year that you keep that street clean, so like we have a lot of volunteers who have adopted the streets, and then there are a lot of volunteers who show up on the green up day and do cleanup.
Okay, so is this something we basically advertise to the public to come help or join?
That is correct, so
Yes.
there are committee members, and they provide stuff to the volunteers that day, t-shirts, bags, gloves, and we basically do different cleanups in different streets, around town.
Perfect, thank you.
Absolutely.
Yeah. Okay. Anything else?
Nope.
Okay. Well, Victoria, again, thank you and good luck with everything. You look like a wonderful young lady. I'm sure you're gonna do well. So, thanks for your presentation. All board members, thank you very much. And Nikki, thanks for your interest. And anybody want to make the always the best motion of the night? Good, Barbara, I can see you're itching to do this.
I'll make the motion to adjourn the meeting.
Yeah.
7:05.
Okay, that's great. Anybody want to second that?
I second that.
Okay. Well, I didn't think I was going to get one. All right. All in favor? Aye. All right. Everybody enjoy the few weeks. We'll see you the first week in May already. And Raj, I'll give you a call. We'll talk about that. But I like that event.
Yes, sir.
Okay.
Thank you.
All right. Thanks, everybody. Have a good night.
Thank you, Ron.
Thank you.
Thanks,
Good
Barbara.
night.
Thanks,
Thank you,
Bernadette.
everybody.
Thank you,
Thank you.
WACA.
Okay.
Thank you.
Thanks, Laura.